Morning, Janet.
Hi, how are you?
I'm all right. I am doing okay.
Social worker as well as a business development consultant within the company. So I do a few different tasks with my job, and I am working remotely just like so many other people are at this time. And unfortunately, and this is a topic actually that was brought up. I'm trying to recall who first initiated this. It was the Baraboo Senior Center actually brought this to my attention and wanted a topic on talking with your doctor, which is what started this a few years ago. And what I chose to do, because I've noticed the National Institute on Aging has such incredible material, we decided to get their permission and utilize this because it was good. So we thought we would just take it and add a few things to ours as well and take it from there. So talking with your doctor, and as a social worker, I can tell you, not only professionally, but also personally with family members, I'm always talking to them about how to prepare to go see the doctor. I think frequently people will just schedule an appointment, go in, come back home, sometimes forget what's necessary, forget the questions they meant to ask, addressing some of the concerns that perhaps they've had that they forgot to talk about, because we don't have a lot of time when it comes to meeting with our physician. So we're going to go through and talk about this a little bit more. You know, I have said over the last few years, it is more important now than ever to develop that partnership with your healthcare provider. People say to me, well, what do you mean by that? I've always had that partnership. And I was like, no, it actually becomes more of a personal partnership that we ourselves as consumers of healthcare need to be more involved. I have actually, just a little side note, with my parents in their mid-80s, when they have some medical issues going on, I'm always like, well, did you ask this? Did you ask that? I should have. Why didn't I? It's like, well, there's still opportunity. This is how you learn, right? So that's what we're talking about. We need to ask more questions. It's more of an interchange now, a verbal interchange between us and our physician or medical group or whomever that might be, any clinician for that matter. And we need to speak up if we don't understand something. I have worked with so many patients that said, well, I went to the doctor. What did they talk to? Oh, they talked about my heart. What did they say about your heart? Oh, I don't know. Something's wrong with it. You know, again, they're not understanding their condition, which makes it more challenging for them to be accountable for how they can try to manage that condition, right? So we'll continue on here. Let's brainstorm. What concerns have you had in the past about visiting with your doctor? Anybody want to share anything? I will share that I didn't get the information that I needed. I know that. I forgot to ask a few things. That's personally what I've done. Anybody else want to join in and share with some other concerns you might have had?
Yeah, basically exactly what you said. Only generally, I'm a pretty good question asker, but it never fails. Once I'm outside the office, that's when the really good questions come into my head. You know?
Of course.
So,
which is true with a lot of things, a lot of conversations we have with people, right? We forget certain things. And again, limited time, we have to be very focused and again, learning about us, right? Not what we're being taught, but again, taking more interest in what we are learning. Elisa, any issues you've had?
I just think sometimes I would like them to give me recommendations for my age. So I'll go in like Chuck, I'll just forget altogether, like, oh, I had these 4 questions I wanted to ask. But sometimes I feel like I want to ask, what should be done next? What is recommended for a woman that's 40, a mammogram or, whatever. But it'd be nice sometimes to remember to ask them like, okay, I came for my general appointment, but are there other things that I should be doing in the future, right? Like a proactive plan moving forward, I guess.
Especially now, we want to be proactive, right? And really understand. So again, that's what we're going to get to, writing down some of those questions and making sure we get what we need answered. And what solutions might help? Well, just some guidance. I mean, you can use some of this information. You don't have to. If you have your own system, have at it, right? It's whatever makes you comfortable. But some people, again, are more quiet and more reserved. Others are more verbal and able to express those sorts of things. You know, what did you eat yesterday? So this is kind of a general question. What we have noticed is that when people have a concern, this is what we've noticed in home health, that will say, oh, I haven't been eating well lately. Okay, so can you tell us more about why? How long? How much are you not eating or you are eating? You know, when did this start? Again, ask you more questions. If we find as a patient that we have a trending concern, we need to track it. Track it. So for example, my mother was saying a few months ago, she doesn't care that I bring her up in these conversations. She said to me, I've been having some blood pressure issues. And she's had them before, but not recently. And all of a sudden she's starting to notice when she's taking her daily vitals, she said, it just doesn't seem right to me. I said, how long? I don't know. Okay, well, let's just write it down. Perhaps what you can do, when do you take it? I take it in the morning. Let's write it down. For that when you go to the doctor, you can present that and say, you know, because they're going to ask you those questions. If you state something, they're going to follow up by saying, well, how long? And when did you notice this? Let's be ahead of the game, right? Let's use our time wisely. So perhaps you can say to them, you know, I've had this concern. It's been going on for a couple of weeks. Now, again, if it's urgent, you, of course, seek immediate urgent care. But the fact is, you know, it's been trending, and I know I've had this issue before. So this is what it was today and tomorrow throughout the week. And I've taken it at the same time. Again, we're trying to show trending. Trending helps physicians a lot. Okay, so that's true no matter what the case may be, whether it be nutrition, whether it be your blood pressure, whether it be your bowel movements, you know, I mean, it could be anything. Trending, and then making sure that you list what that is. People say, oh, for goodness sake, I got to keep track of that. And it's like, really, it's not a big deal because you're still taking your blood pressure. You're just going to write it down. That's all, right? So again, this can be very helpful with people as they're trying to monitor their own concerns, but yet preparing for that appointment. And tell your doctor, you know, what the health concern has. And, you know, if you don't have the notes with you, it's a lot easier just to reference them. Always a good idea to write down, journal what it is, at least during the time of your concern, right? And then also ask them, do you want me to continue doing this? And again, as a consumer, I would like to perhaps is build that right into my routine. Again, not a big deal. If it's a concern, let's stay on top of it. Getting ready for the appointment. So, you know, we need to create a plan. It's not just let's show up. You know, we're going there for a reason. Let's list and prioritize your concerns. Now, we're not going to sit there for 20 minutes being able to express our concerns. We have a very limited amount of time. So we know, generally speaking, you come in, the nurse meets with you, they go over your meds, they do your vitals. It might be the nurse, CMA, CNA, whoever it is. And then they're going to ask you, what concerns do you have today? This is a great opportunity to either hand them your list of the priorities or just share them verbally. But always, no matter what, note other health or life changes since your last event. And people say, oh, well, I understand why I would mention some health issues, but why would I mention life changes? As a social worker, I guarantee that life changes will have direct impact on your medical condition. Okay, so perhaps someone might have, let's use the blood pressure issue again. And along with the blood pressure, there's an anxiety level, right? and let's say they've had some traumatic loss or some traumatic change in their routine, whatever the case may be, we want to bring this to their attention. People who are depressed, perhaps they've lost a loved one, perhaps they, had a medical emergency a month ago, or they went to the emergency room, or their urgent care, anything that's changed since your last visit, always is best to bring up. People say, well, it's probably in the record. Well, it sure is, but it doesn't mean you can't bring that up to bring them up to date just now, to let them know. So note other health issues and life changes. I think it's huge. People talk about the anxiety, and especially now with COVID and all this stuff, people have lost jobs, people have mental health issues, right? I mean, mental health issues have increased 600% in this country during COVID. This is pretty scary stuff. So, I mean, these are things that really do have direct impact on one's overall well-being, their entire body, right? Let's bring up some of these concerns. Perhaps there's something that can be further talked about. So gather some information, always a good idea to other doctors' contact information, I mean, yes, they can obtain these things in the chart, but let's say you have, again, a blood pressure concern, and perhaps you have your primary, and then you have your cardiologist. Let's make sure primary knows who that cardiologist is. Yes, he or she can go on the medical record, but say, hey, since I've seen you last, I went to see Dr. So-and-so, who's the cardiologist. Bring it to their attention. It's good to do that. Insurance cards, of course, we should bring those. And, again, depending on the clinic, depending on where you go, is what they will require, but always carry those insurance cards and the Medicare, medical history, and medicines, whether it's a list. That's awesome. You need to bring your most updated list. And please, no matter what, make sure it's not just the prescriptions. You have to also include over-the-counters. There can be adverse drug events. You need to let people know if you have over-the-counter medications, you have any herbals, any supplements, any drops, any creams, right? Let's make that list thorough. Keep that list somewhere with your medical stuff. Update it as you need, because that is your document. You want to make sure you know exactly what you're taking, right, at any given time. Makes it so much easier to try and remember, and also for others to remember, perhaps a person that's taking you to the doctor or you can't answer, whatever. We want to make sure that that's available to them as well. Think about what you'll need. You'll be surprised how many people go to the doctor, they forgot their glasses. Shucks, I forgot my glasses. I can't see what you're saying or what you need or what I need to write off on something. I strongly recommend you bring a family member or a friend. I think that if everyone got into the routine of having somebody go with them to a medical appointment, it is to their advantage. You got 4 ears listening versus 2. Many times the other person's going to recall what perhaps you forgot to ask. We always want to make sure that person understands that we're on the same page and they can reinforce behaviors or reinforce taking the medication, whatever the case may be. You're sharing your healthcare experience with that person that you trust. And if that person can go with you, have at it. That's wonderful. Strongly suggest that. And of course, if you need an interpreter, we need to ask that ahead of time if there's a concern regarding interpretation. All clinics and hospitals are obligated to provide interpreter services if needed. Setting your plan into action, really sharing that information with your doctor during the visit. This is where the important information is, that we don't lose what we want to share. So let's look at this image right here. What do you think is going on in this photo? We've got a woman, she looks like she's trying to share some information. You can see her hands up. The provider is looking at her, waiting to hear what she has to say. What could this woman be feeling? I mean, I don't know. Is she in pain? Is she anxious? Again, describe the image. What might her symptoms be? We want to be able to express it very openly, very succinctly, to make sure that that person understands what we're trying to share. So again, we are responsible for how and what we share. But again, they can't read our minds. She's waiting to hear what that explanation is going to be. So sharing the information with your doctor. So when they say, you know, what are your concerns? All right, you've got your list of priorities, but what are your symptoms? What has brought you to that visit? What has led you to that visit? You know, again, is this something that's been going on for a while, or are you just experiencing more symptoms? Identify what those symptoms are. Well, how does that make you feel? Well, you know, I've been short of breath. Okay. How long have you been short of breath? Are you short of breath at certain times of the day? When are you taking your medications? When did they start? How often? What makes them feel better or worse? And how do they affect your daily life? You know, we want to share, again, with our physician, how the impact of our medical situation impacts our daily life, right? So again, we have to share the symptoms. We have to share perhaps that journal that identifies those different blood pressure readings. It's okay. Share that information with them because they're going to be asking. You might as well have it ready. Go over the medications, and you want to make sure that what they have in their electronic record matches what you're taking. So it's not just the type of medication, it's the dosage. It's also how is that medication taken. And again, share specifics, even with the herbals and the supplements and the drops, all of that. We need to share the specifics. There are so many adverse drug events out there that cause other problems that lead to the hospital. Perhaps dizziness and then a fall, and all of a sudden you're at the hospital, right? Medications can be a cause of that. So we want to make sure that our records are the same, that we have a very good understanding of how and when and what we are taking. I also highly recommend that people understand what each medication's for. Oh, I take this little white pill and that's for my heart. Okay, well, what is it? What's the name of that medication? And is it for chronic heart failure? Is it for atrial fibrillation? What is it being used for? Again, more knowledge that we have regarding what we are ingesting makes sense. So again, understand what those medications are for. Tell the doctor about the medications, any issues you might be having. And then, of course, voice other concerns as that interchange of conversation is taking place. So it's a dialogue. You know, years ago, we'd go into the office and we would just patiently sit there, and then the provider would come in and the provider would share and talk to you. And we'd sit back and say, okay, 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 take what we need and off we go. Now, and this has been for a few years, this is what we really need to start doing. We need to have this dialogue back and forth. You share your health concerns, your doctor asks about the symptoms, you answer the questions, your doctor shares the diagnosis, you ask more questions to better understand, and then your doctor answers those questions. It needs to be interchangeable. You need, as a consumer, need to feel comfortable with your medical care. And if that means you ask more questions, that's what you do. If the person's with you that accompanied you to that appointment, perhaps they have questions. This is why it's nice to take someone with you to the doctor to get more clear answers. You know, a lot of times about tests, they'll mention different things. Well, you know, there's different tests that we can do. Okay, well, then it's our job to ask, what are they? What will the test tell us? What is it involved? How should I get ready? And are there any dangers or side effects? Because ultimately it's your decision to have this test. Even though a physician or group will say, you know, this is what we recommend, we really need to do this test in order to find out about this, in order to further treat you. Get that answer. You know, what is that test going to tell you guys if I indeed follow through with this test? We need to be asking more questions. So again, what is the test? What does it involve? Why are we doing this test? And what are the dangers and side effects? So ultimately, it's you that decides if you want the test. I mean, physicians and groups will recommend, but it doesn't mean that you have to do anything. It is your choice. But this is why the questions are so vital that we ask our physicians. How about questions regarding your diagnosis? I am floored when I go out to see patients, or when I used to go out and see patients all the time. I would talk to them and say, okay, you've got a certain diagnosis I see here, and I'm just wondering, it shows me here that you have chronic heart failure. And then, do you understand what that means, Mrs. Smith? And she'll say, I don't have a good heart. Okay, but do you understand what chronic heart failure means? Right? Yeah, perhaps you don't have a good heart, but do you understand what that diagnosis means though? Okay. So, and then you ask the doctor, what does that mean? What may have caused that condition? Will it last? Is it permanent? And how can I treat or manage this condition? Because of course we're spending 10, 15 minutes in that office, right? But we're spending the rest of the time at our home in between visits. So we need to find out, how am I going to treat or manage this condition once I leave here? How will it affect me? So again, asking more questions, understand what your medications are used for, why you take them as often as you do or not. I mean, ask those questions. And what is the medication related to? What diagnosis? And what does that diagnosis mean? You know, is it a chronic condition? Is it an acute condition? Is it something that can be managed? Because ultimately what happens as we age, we tend to get more and more of these chronic conditions, which means it becomes more challenging for us to manage these conditions all the time. So we need to be educated on how to best manage those at home. And that's where the physician and the medical group are able to guide you in order for you to better understand. Validation. So sometimes we hear what somebody says, but it doesn't mean that it's always being interpreted the same way. So as we say this, whether it's personal, professional, medical, or whatever, always best to ask those questions. So I think what you're saying is, let's make sure that you understand what that person is saying. Again, this can be used no matter what situation you're in, but it is always best to validate. So what I hear from you is, you know, is that correct? Am I right? That they have the opportunity to share additional information or to really reinstate what they're trying to say to you. So again, try to understand and make sure that you're understanding it correctly. Miscommunication is a huge, huge issue no matter what situation you're in. So let's try to ask those validating questions to make us feel more secure about our questions and answers. So some questions you might want to ask about treatment options, very similar to what was brought up before. What are the treatment choices? Right? Maybe they're sharing one treatment option for you, and you might want to say, well, are there other treatment options, or is this the only one that's available to proceed with? What are the risks and benefits of those particular treatment choices? Why is this treatment more appropriate for me versus the other treatments? ask yourself which treatment is best for you and in your current circumstances. Because there are different choices for people, and some people choose depending on who they are, their situation they're in, the circumstances, their values, their morals, whatever the case may be. So we're asking those important questions. Think about some general questions. If you take anything, this is what you want to take from this presentation. We have to manage our doctor-patient partnership, because that's what it is. It's a partnership. We are both trying to address a concern, an observation, or a medical issue. So it's a partnership. We are as responsible as the physician or clinician in asking the questions we feel we need to understand what we are going through. I recall a personal situation when my husband was very ill and he was in another hospital for a few years. And I tell you, I used this information so much because they would tell him things and then I would show up and I'd be like, well, what is that? I'd have my own set of questions. And I wanted to feel secure if I was going to be the caregiver. What does this mean? What options do we have? So again, we have to prepare for our appointment. We need to write down our concerns. You need to write down and prioritize those concerns. You need to have that thorough list of medications, over-the-counter, supplements, dosage, when it's taken, and for how long. You also need to know what that medication is for. You have to change your medical or share any changes that you've noticed, any symptoms you've experienced, any resolution to problems. Most importantly, making sure you understand what the doctor is telling you. Again, those 4 ears are much better than 2. And frequently, you will see that you are both asking questions because things are coming up and you're thinking, oh yeah, I forgot to mention, right? Very, very important that you keep that in mind and take notes or ask the doctor to write down information if you have to help you remember. So perhaps the physician is sharing a name of a test or a diagnosis. Well, I don't really understand. Do you mind writing it down for me? It allows me to learn more about that. Because again, you want to empower yourself to learn more. I think we can all better manage our conditions and our concerns if we become more intimately involved with the medical system. So that partnership is really vital. You'll sometimes notice people that are aging have become very attached to their physicians. It's because of a relationship that you've built with a physician group or a physician or nurse or whatever. Again, that's part of that partnership and understanding where we're coming from and to be able to actively seek out medical care. One thing that we have noticed a lot in our company, which is SSM Health. So, I mean, it covers clinics and hospitals and home health. And one thing that we've noticed is that, especially right now, and even at the beginning of COVID, is that people were less interested in going to their doctor because of a condition or presenting at the urgent care or emergency room because of the pandemic. And then it kind of lessened up, you know, and now it's going back to that again. Because of the numbers right now in Wisconsin are horrific. And so we've noticed people just kind of holding off on contacting their doctor and making visits because they feel like, well, there's so many other people that are not in a good situation. No. If you have symptoms, please reach out, because what we are seeing is people are not seeking physician appointments to address their signs and symptoms, instead are waiting, and then something happens more dramatic, which results in them having to go to the hospital. And now, oh boy, you don't want to do that, right? So yes, COVID is a concern. This pandemic is a concern, but it does not mean that you still can't pursue your own healthcare, because we have learned to do that very effectively. It may not be exactly the way we want it to be, but we have to do what we need to do right now to make sure that our healthcare needs are being met. And people will say to me, well, that sounds awfully selfish. It's like, no, it's not really, because what we're trying to do is to make sure people don't get more sick. We know that mental health is having a huge impact on people. People have mental health issues during this COVID. We know that that has a direct effect on their overall medical and functional life. So if I can emphasize that as much as I can, how important it is to maintain consistency and reaching out when you need to. I do hope that this information is helpful to you. And Chuck, we have this PowerPoint that Elisa could always forward to you as well. I encourage sharing this with other people, your friends, your family, your neighbors. I think the more that we empower people to be more in charge of their health care, the better off all of us are going to be. Because communication, of course, is the key. And so we have to take ownership of that as much as our physician and medical group do. Questions, comments?
Yeah, first of all, I just want to mention something about having 4 ears there. I am a transplant patient. I received my transplant almost 10 years ago.
Nice.
And whenever I have important appointments, I always make sure, because I have found that when you are told something by a doctor, you sit and you kind of stop and you're digesting that in your head and you're not hearing anything else that he's saying for a while. So it's really beneficial. I mean, I can't sell that enough to people.
You know, good for you, Chuck, because that's exactly right. You know, and sometimes people are like, well, you know, I don't want other people being involved. It's like, well, you know what? I mean, I get it. I understand it's personal, but there has to be someone there that can help you, because if the roles were reversed, you'd be doing the same thing. And you are so right, Chuck. When you hear something, you're just like, oh, and now the person's still talking back here, and yet you're still processing what was stated. And you're trying to, again, not only process, but come back with questions and come back with comments or whatever. And you find yourself not listening to the rest. Right. I know when my husband was sick, he'd go to these doctors, you know, I want to go by myself. That's fine. Go ahead. And then he'd come home and I'd be like, well, what about this? What about that? And And then finally, I was like, can I just go with you? I mean, to the important appointments. I mean, follow-ups. I mean, other stuff I don't, you know, whatever. But these important ones, I mean, I have a lot of questions too, and how I can support you. So again, we need to be asking those questions. Otherwise, we're just putting more pressure on our healthcare system, to be quite honest.
Right. And plus the partner tends to understand some things that maybe I won't understand. You know,
Exactly. What are they observing?
Right.
You know, is there something they can do to help you in your recovery?
Right.
So you are exactly right. That is a huge point.
Another question I have is, my primary retired this spring.
I know.
I haven't gone back I've chosen a new primary, but I haven't seen him. Are there any special questions or information that I should relay when I finally do go in and see him?
I would strongly suggest that you let that physician know what your expectations are. You know, this is how I work. This is what I do. I'm really on top, you know, I'm right on top of my medical situation. I tend to want to get answers. I love to communicate. I prefer email, or I mean, whatever. And what does that physician expect of you?